Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, here I'm Tsania Taskia with the student ID number 1811201005 going to present my case-based study assignment entitled The Application of Allogeneic Hematopoietic Stem Cell Transplantation for Leukemia Disease Treatment. So this is the assignment of embryo transfer technology and stem cells lesson. And I made this PowerPoint based on all of my knowledge and review on some related journals. And I try to deliver this presentation in English to practice my English skill. Next, the first one, we're going to talk about the definition of leukemia. So leukemia is a group of hematologic disorders. As we know that leukemia will happen where there is an imbalance ratio between the erythrocyte or red blood cells and the leukocyte cells compositions. Or we can say the leukemia will happen where the leukocyte cells, the total of leukocyte cells will arise, and it's much more than the normal blood. And the result of dysregulated of hematopoietic stem cell or HSC include chromosomal translocation and somatic mutation causes leukemia stem cell. Over 70% of such patients will enter the first complete remission after induction chemotherapy, yet the substantial number experience disease relapse. From this sentence, from this statement, we can say that the leukemia patients will be cured after the exposure of induction chemotherapy or IC, but over the time they will relapse with the disease. The disease will relapse. And then what's the solution of this problem? The solution is the usage of allogeneic stem cell transplantation or allo-SCT. So this is the method for the curative way. This is the visualization of allo-SCT. So this is the blood cell taken, using a certain searing. The next one, we're going to talk about allo-HSCT in brief. Allo-SCT is obtained from donor after myeloablative conditioning or high-dose chemotherapy process. So when a patient will be given or will be transplanted by hematopoietic stem cell, they have to do the high-dose chemotherapy process to suppress the cancer, the leukemia cancer. It's suitable for consolidation of favorable or intermediate risk AML patients in CR1 of the first complete remissions. Allo-HSCT, from my not fluent, has lower relapse risk than auto-HSCT in multiple myeloma, even it may cause the adverse risk for profiles. It means the graft versus host disease or GVHD. So the allo-HSCT is the state-of-the-art method to cure the leukemia, yet this method can cause the adverse risk. So what's the adverse risk? The adverse risk That's the graft versus host disease. So the body, the patient's body will reject the the hematopoietic stem cell graft by the immune system. With considerations of this therapy, the low ACT therapy, the transplant-related mortality and disease will relapse, and then over at least or approximately 40% of post-ACT AML patients will relapse. This is based on the data from Therigotis et al. 2016, and then the next is facing a dismal prognosis with a 2-year survival of less than 20%. So this is the considerations. So based on these considerations, we have the researchers or the doctor, we have to choose the next or the subsequent treatment to cure the effect of a low ACT. Now, before we are going to talk about the steps for conducting the low ACT treatment, we have to know about the hematopoietic stem cell hierarchy. So this is the hierarchy of hematopoietic stem cell. The first one is the forming of blastocyst from the embryo stem cell. So the blastocyst will be divided into 3 parts. The first one is ectoderm, and then the second is endoderm, and the next is mesoderm. So the hematopoietic stem cells are made or are formed from the endoderm parts of the ESC, and then from this we can say, or we can understand that the hematopoietic stem cell or HSC pool is highly heterogeneous, containing long-term hematopoietic stem cell or LT. This is LT-HSC, intermediate term HSC, and short term or ST-HSC. And then the cells are multipotent. The cells are multipotent with differing self-renewal abilities. HSC differentiate into 3 parts, include MPP2, MPP3, and MPP4 subpopulations, and MPP2 and 3 will differentiate into the common myeloid progenitors or CMP, and then we can further differentiate into mature hematopoietic cells via megakaryocyte, erythrocyte progenitor or MEP, and granulocyte macrophage progenitors or GMP. This is GMP stages. And then the MPP4 primarily differentiate into the common lymphoid progenitors or CLP. This is CLP followed by the forming of T cells, B cells, and NK cells. This is the immunology cells. Okay, and at this leukemia field. Oh, yeah, at this leukemia understanding, there is a word called CR1. CR1 stands for the first complete remission. It was defined as remission achieved within 2 consecutive induction chemotherapy regimens. CR2 and CR3 were defined as a remission after receiving salvage chemotherapy for first or second relapse. Okay, now we go on to the next slide about steps to conduct a low HSCT for leukemia treatment. So this the overall process, the overall procedures to conduct the allograft or the allo-SCT, simply called allo-SCT. And then the first is, of course, allo means allograft. So there are recipient and donor. The recipient will be conditioning by any kind of chemotherapies, and then the donor will be harvesting the bone marrow of the donor will be harvesting for to take the hematopoietic stem cell, and then the hematopoietic stem cells will be transplanted into the recipient body, the recipient's host body, and then the next step is severe myelosuppression as conditioning takes effect. So this is the effect of the allograft procedure, and this is the engraftment requirements for neutrophils. Needs the total of cells, while these platelets the total of these cells. So who should be transplanted in CR1? So the ELN or European Leukemia Net Group recommended consideration of allo-HSCT in fit adults with AML in CR1 who have a predicted relapse risk of 35 to 40% and a suitable donor. So this is the patients that can be received the allograft or the allo-SCT treatments. But if the patients with the IC alone more than 40%, the IC alone means the relapse risk of 40%. So they are not allowed to give or to receive the allo-SCT. And then for the high patients will the TRM or transplant-related mortality will take place. The considerations are age, comorbidities, and donor. And then when the TRM or transplant-related mortality is high, so they cannot be proceed to allo-SCT, right? So it means that the high-risk patients cannot be received the allo-SCT because the TRM is high. The TRM value is high. Well, whereas the TRM, the low predicted TRM, will be proceed to allo-SCT. Next, about post-remission options include prevention, detection, and treatment strategies. And then this is the detection methods consists of multi-parametric flow cytometry or MFC, molecular genetics, and then the chimerism. The treatment of AML relapse after transplant is challenging, right? We have to highlight this statement. Due to a high rate of patients who either cannot tolerate intensive therapies as a consequence of toxicity of the previous transplant, or do not achieve durable remissions by any treatment. Profit. Okay, that's the sentence that we have to pay for attention. And then the last is about the treatment and the prevention of the alloacity effect, negative effect, of course. So based on the time of intervention, it can be divided into two parts. Prophylactic approaches started when no evidence for leukemia is present, and the second is preemptive approaches, which are initiated at the time of MRD detection to avoid hematological relapse. Those approaches administered or given at the stage of hematological relapse. The elaboration or the decipherment of the molecular landscape in AML has facilitated the still ongoing development of targeted therapies. So this is the molecular landscape in AML, means the leukemia disease. This is the therapy, chemotherapies, include the FLT3 inhibition. FLT3 is a gene that plays an important role in the leukemia disease forming. And then the anti-CD33. CD33 is the receptor of our cells that plays an essential role in the leukemia disease. And then the usage of hypomethylating agents are needed to suppress the nucleus activities. And the last is IDH inhibitors, include this chemotherapy medicines, to suppress the alloacity, to suppress the activity of alloacity. So the alloacity we won't be that's right. Okay, that's all from me. Thank you for attention. Pardon me if my speaking is not fluent, so I still in train, Okay, that's all from me. Thank you for attention. Wassalamualaikum warahmatullahi wabarakatuh.